DPP-4 inhibitors, these are medications like Januvia, Onglyza, Tradjenta, primarily the ones that I think of in this group. These are oral medications for treating type 2 diabetes, and they are part of the incretin family, or they work within the incretin hormone system in the gut. This is the same system for which we have the GLP medicines, the injectable medicines that help with weight loss. So what happens there is that, again, we have cells within our small intestine that produce this group of hormones called incretins. They are released when we eat, and then they go through our bloodstream, and they do a number of different things to help us with respect to digestion and managing blood sugar metabolism. And so the DPP-4 enzyme is responsible for breaking these hormones down so that they're out of our system. So we make them, they have action, and then we get rid of them. So that's normal. So medicines like this will block that enzyme. So then the natural hormones are there a little bit longer and can work a little bit more than they would otherwise. Now, the effects of these medicines are a little more narrow in scope than what we will see with the GLP medicines. The biggest benefit that we get from this kind of medicine is that it will help us make a burst of insulin, a stronger burst of insulin when we eat than we would otherwise. So a common problem with type 2 diabetes would be that, I eat something, I need to make a surge of insulin to keep up with that sugar that's coming in, and I just can't make enough of it, so my sugar goes up. So this medicine helps you make a better push with that insulin. The other thing that is interesting and helpful about it is that it will only work for making that extra insulin when you're eating. So it's a pill you take once a day. It's in your body 24 hours at a time, but it's not constantly pushing you to make more insulin. A similar medicine called sulfonylureas, glipizide, glimepiride, they do also push our pancreas to make an extra burst of insulin, but they're not as discerning. It's just, it can always happen. So when you have that group of medicines, you have the risk of low blood sugar. So the nice thing about these medicines is it'll help you in this regard, but it only works when you're eating. So it won't cause hypoglycemia by itself. This is a group of medicines that right now, February 2026, is still a branded group, not generic, so there can be some cost associated with them. Their effects are generally mild, so they're not the strongest medicines out there, but they tend to be one of the better tolerated medicines. Most other diabetic medicines, you say, okay, you take this, you can expect that this is going to be something you might deal with that's not going to be pleasant to some degree. The DPP-4 inhibitors are usually, again, nothing's 100%, but most of the time the easiest to handle. They don't cause an upset stomach. They don't have any other usual obvious problems in most patients. So it's a kind of medicine that I would say is not the first thing I think of. It's more of a specific situation where it fits well. Somebody who has side effects with other medicines, somebody who's having trouble where their sugar is jumping after they're eating, but it's mild, somebody that we want to avoid the risk of low blood sugar. They're particularly fragile, and so in that regard, so we can use this to feel a little more safe about it. And somebody who doesn't need a lot of help. We want the A1C to be under 7%. So maybe they're in the 8 to 9% range, something like that. At much more than that, you're probably not going to see, the kind of benefit you want. These are weight neutral drugs. They won't make you lose weight or help you lose weight. They won't make you gain weight. Because they work in the same hormone system as GLP medicines, we don't want to use these medicines with GLP medicines. Sometimes I see that end up happening where somebody's on one and the other gets added, and you don't want to do that just because it's a redundant therapy. As far as safety, these are generally safe medicines. Now, there have been some studies that show that it can increase the risk of having pancreatitis. Still, although the risk is significantly higher when taking it, it's still something that's very, very uncommon, or very, the risk is generally very low. So a little bit more of that very low risk is kind of what we're talking about. So unless somebody's had a history of pancreatitis or we're particularly worried about it for some reason, I don't usually let that potential side effect stop me from considering it. Of course, you have to make sure everybody's comfortable with that. But I prescribe these medicines regularly, and I can remember maybe one or two times where somebody has gone on to have pancreatitis. The other thing that's reported that I haven't seen a whole lot, but it's reported, is that some people will get severe joint pains with this. Like I said earlier, this is one of the better tolerated groups of medicines. So I haven't seen that as often, but when you start any new medicine, do you feel something bad that's new right away that goes along with taking the medicine? In this case, it would be, abdominal pain if we were worried about pancreatitis, or severe joint pain. So those are the things you want to maybe warn the patients about, or be aware of if you're going to take this kind of medicine. I think those are the main points to consider. So a potentially helpful group of medicines, not my favorite, not the first line type of thing that I want to use to, really help people with weight loss and blood pressure and everything else, again, because it's such a mild effect. But it can be really, really good for for certain people.